This section of the show is called Ask FPA. You can send your medical questions to tv@fpalex.com and include your name if you would like us to use it on the air. Tonight's question is, at what age should I stop needing pap smears at my checkup? To help me answer that is my partner at Family Practice Associates, Dr. Mary Henkel. Welcome.
Welcome.
So when do you start, when do you end with a pap smear?
You start at age 21 and you end at age 65.
Does everybody?
Give or take.
Give or take. So if you're pretty healthy and you're 75, but you're really the new 45, you can get a pap smear. It just happens to be that those are the recommendations.
Those are the typical recommendations, but there's different sides to the story.
What happens to, what are things you can do to maybe prevent cervical cancer, which is what a pap smear is looking for?
The main thing is to get a pap smear and start at age 21, and every 3 years is the recommendation. They also include a test called a HPV test with pap smears at certain ages and at certain times, which can also help in detecting cervical precancer.
Now, HPV is the human papillomavirus, and there is actually a vaccine for that now.
There is. It's for boys and girls, and it's for ages 9 to 26. If you get the shot between 9 and 14, it's a 2-shot series. However, if you don't get it before age 14, it's a 3-shot series.
And it helps prevent HPV, which can be a precursor to cervical cancer.
Right. It's a type of virus that can invade the cells and cause changes that can create dysplasia or abnormal cells.
So you do your pap smears, you do everything right, but you still got to go through menopause. When does that occur, and how long does it last?
That's a great question. And when I first started practice, I asked the infamous Dr. Tom Duncan, who has since retired, but he told me the answer is several weeks to several years.
A lot of women don't like to hear that.
Yeah, they don't like to hear that, but on average 4 years.
So what happens with menopause? What symptoms, what treatment do you do?
Well, your ovaries, not your ovaries, but our ovaries shut down and estrogen decreases and periods cease. And after you haven't had a period for 12 months, that's the definition of menopause.
Hot flashes are the big thing.
Hot flashes, vaginal dryness, mood swings, forgetfulness can occur.
Any treatment, or you just have to suffer?
Well, you can try hormone replacement therapy. It's really less is best. The lowest dose for the least duration of time is the best treatment choice because of risk associated with hormone replacement therapy.
We used to use hormone replacement therapy a lot because it not only helped to prevent the symptoms of menopause, but it helped with osteoporosis, and that's something you see in menopause.
It is, and estrogen does help with osteoporosis. However, the risk at times outweigh the benefit. And there are other things that we know that can help with osteoporosis, and we have good ways to screen for osteoporosis.
Tell me about screening. Bone density is helpful?
Bone density tests are helpful. We generally start at age 50. It really depends on risk factors that the patient has, but on average, age 50. Because when your estrogen starts to go down, then your risk goes up. And for men, age 70.
And it's a pretty easy test, something you do in the office. It's not
simple
something you have
test.
to go.
We actually have one.
And you just lay down and get scanned.
It takes 5 minutes.
All right, quickly, mammograms. How often?
That's a good question. Revised guidelines per the American Cancer Association is to start at age 40, and really it's age 40, it's an option to get it, but if you do start to get it, we recommend getting it every year until approximately, well, it's really until around 74 years of age for a female. When the life expectancy becomes closer to less than 10 years, that's when you should stop getting a mammogram.
So if you're in the process of getting it, you ought to talk to your doctor about when and how often.
Yes.
All right, great information. We'll be right back after this.